examination.
So
How do we start?
Let's do that. That's a great...
So good thing is to have a chat to the owner. Firstly, I would like to know how old the horse is and what do they do with the horse, what discipline they do with the horse, because that's the other thing I was going to say with the wolf teeth. It depends on the position of the horse's head.
You mentioned.
For example, in polo, where they use gags and the horses run with their heads up, they do crush the cheeks on those first cheek teeth. And at one stage, it was very fashionable to do bit seats. But we have now moved away from bit seats.
Will you explain what a bit seat is quickly?
Okay, let me show you on this. Oops.
Don't lose the horse.
No. So a bit seat is where we round these first premolars, the bottom ones and the top ones. But the problem is you can open the pulp cavity. I don't know if you'll really be able to see that. And then you can actually have a diseased tooth from that.
Okay.
So now they've become very conservative with bit seats. You can round it a little bit. We always do with most riding horses. I like to round and especially make these a little bit smoother because that is the widest part of the mouth and that's often where
the nose band
is. So we like to have these a little bit smoother, but it is important to keep your rougher edges, not sharp points, but it must be rough.
I suppose that's how they have to chew as well.
Have to chew, exactly.
That is the purpose of the tooth.
Anyway, okay, so history of horse and what they're doing, and then I would like to, then you basically look at the horse's head and palpate, and we always palpate the TM joints.
So would you mind explaining what the TMJ is?
There goes a tooth. This is the TM joint. Okay, it's also an incongruent joint, and it has a meniscus, just like your stifle or knee joint has. Okay, and then we'd like to check lateral excursion. I don't think I'm going to be able to do it in my skull, but we move the mandible relative to the maxilla, and you should be able to see at least 1.5 bottom incisor on either side, and we check if that's symmetrical.
So when you check
often
it's not. Really?
Horses are funny. They tend to like to chew on one side. You very often see that
That's really interesting.
More worn on the one side, and especially when there's pathology.
Of course, when there's pathology,
then they start chewing more.
So when you look at the TMJ, is that to see how much they open the mouth?
Well, that's usually when we open up with a gag. But no, so it's lateral excursion. So we check that. But we palpate them as well. It's actually TMJ pathology is very, very rare. There was now
It was very popular at one point.
Oh, yeah, exactly. Anyway, so that's what we do. So and then I always run my hands on the side of the horse's cheeks. And very often, if it's very rough, you can actually feel, and you also monitor the horse's response. So if they've got ulcers from sharp
on
points,
the inside of the
they
cheek.
will, on the inside of the cheek, they will often resent you palpating that. Then we have a quick squiz, lift up the lips, look at the incisors, check the canines and the geldings. Very often they get quite bad tartar accumulating on that, and we just clean those. But then I will sedate the horse, okay? Because if you want to do a proper oral examination, you need to have a fairly still head and a still tongue. If you try and look at a horse's mouth, you'll see how that tongue goes, and they push their tongues up, and you can't really see much of the oral cavity. So it's one of the reasons why we sedate, is to actually do a proper dental examination, and we use either a little mirror or now they've got very fancy oroscopes, which is really the best.
Okay.
It's very expensive, and you do not want horse to damage your oroscope.
You don't want them to choke.
So a horse must be very well sedated. Okay. You know, I always say to people, a lot of people complain about the sedation, but you can do so much better job. And it's not traumatic for the horse. You can imagine if you've got this rasp in the horse's mouth. Now suddenly it jerks its head. You can really, and I've seen really bad lacerations on the tongue, the palate. I know of fractured palates with rasps. So it's just not, and it's an unpleasant experience for the horse. The one thing I just want to reiterate, remember we use highly scheduled drugs for sedation, so it's only administered by a veterinarian.
Yes.
The dental technicians are not allowed to sedate horses, and very often they will get a vet to sedate the horse.
Makes sense to pre-book everything. So if you know your dentist is coming out every 10 months, call the vet.
Life so much easier, so much more pleasant. And you know what? You're not doing this like shoeing every 5 weeks. So budget for it and have it done properly. So we obviously also use a headlight, and it's important to have a very strong, I like a focused beam rather than a wide beam where you have shadows. And then this is a gag. It's quite a dangerous piece of equipment. That's the other reason why I think it's important to sedate a horse. Okay, so then we will open the mouth, and with my, of course, first rinse out the mouth very well. So we use a dental syringe to do that. And then you use your speculum or your oroscope, and we go through each tooth. And I normally have an assistant with a dental sheet, and I tell her.
That's great. So you mark off each
so
tooth.
We have records. I think that's the other thing that's really important, because then it's so nice when, so we write down how much sedation we gave the horse, because that's also very variable. So it gives you an idea if you've battled with one horse and you've had to top up, then next time, you're just going to give it more from the beginning. And then those records are really good history, and we'll also write down when you'd like to see the horse again.